Cardiac catheterization is a procedure used in the diagnosis and treatment of cardiovascular conditions. It involves the insertion of a catheter into a cardiac vessel, coronary catheterization, or chamber by way of a suitable vascular access, usually a femoral or radial artery. Once in position, a cardiac catheter can help evaluate the blood supply to the cardiac musculature, angiography, or open up narrowed or blocked segments of a coronary artery by means of a coronary angioplasty with stenting, percutaneous coronary intervention or PCI. Procedure or overview: General. Arterial catheter insertion sites are femoral artery, radial artery and brachial artery. Femoral artery is the most common. Imaging: a contrast dye is injected via the catheter and is visualized with serial X-ray imaging. Pre-procedural testing (ECG). Lab tests which are done or complete: blood count (INR) and prothrombin time, serum urea and creatinine. Coronary angiography or ventriculography. Description: contrast-enhanced radiological analysis of the heart cavities, that are ventricles, ventriculography, or coronary arteries, coronary angiography. Indications: coronary artery disease patients with unstable angina, coronary artery disease patients with adverse effects from medical therapy, coronary artery disease patients in which conservative control of symptoms has failed, coronary artery disease high-risk patients, those with signs of ischemia during stress ECG. Coronary angiography is done in coronary artery disease patients to assess the exact location and extent of coronary vessel narrowing before possible PCI or surgery. Other indications of cardiac catheterization are valvular or myocardial diseases with symptoms, for example, shortness of breath, recurring chest pain of unidentified cause, preoperative evaluation prior to non-cardiac and planned cardiac surgery in high-risk patients, to detect and quantify the presence of an intracardiac shunt. These are all indications of coronary angiography or ventriculography. Coronary angiography is not a screening method for coronary heart disease in asymptomatic patients. This is left coronary artery. This is left circumflex artery. This is left anterior descending artery. This is diagonal branch. Here left anterior descending artery is stenosed, so there is no blood flow further. Here you can see the guide wire. Here balloon dilatation is done and reperfusion is achieved. Further to this stenotic patch, partial stenosis has been relieved by balloon dilatation and reperfusion has been achieved. Remaining stenosis will be relieved by stenting. Percutaneous coronary intervention or percutaneous transluminal coronary angioplasty. Description: a therapeutic procedure carried out during cardiac catheterization in which a blocked coronary vessel is opened and appropriate blood flow is restored. A balloon catheter is used to dilate the narrowed section with or without the placement of a stent to keep it patent. Indications: acute and chronic occlusion of coronary arteries, myocardial infarction, primary revascularization or primary PCI, occlusion of bypass graft and stents, recurrent ischemia after PCI or bypass surgery. Procedure: a catheter is inserted through the access site. A deflected balloon catheter is advanced into the obstructed artery. Balloon is inflated at the obstructed or narrowed section. The narrowing is relieved. Stent may or may not be deployed to keep the blood vessel open. Types of stent: bare metal stent, drug-eluting stent. Coronary angioplasty with stent placement. Angioplasty is a surgical procedure to open arteries that have been narrowed or blocked by the buildup of plaque, a fatty substance. The use of a wire mesh tube called a stent helps keep the artery open. Catheter inserted into arteries. Here, this is femoral artery. This is cutaway view of a coronary artery. This is plaque. This has caused stenosis of the coronary artery. A flexible tube called a catheter is inserted into an artery and threaded to the site of the blockage. Near the tip of the catheter is the stent wrapped around a tiny balloon. Once in place, the balloon is inflated, compressing the plaque and opening the artery to blood flow. The stent expands and attaches to the artery wall. Here balloon is inflated. The balloon is deflated and removed along with the catheter. The stent remains inside the artery to keep it propped open and allow increased blood flow. Here is the stent. Balloon is retracted or removed. Electrophysiological study. Description. Testing of the electrical conduction system of the heart to assess electrical activity and conduction pathways via cardiac catheter. Indications. Diagnostic. To evaluate various repeat refractory cardiac arrhythmias. Therapeutic. Radioablation of areas of excessive pathways, areas that generate and conduct the arrhythmias. Placement of intracardiac pacemakers or defibrillators. Right heart catheterization. Description. The passing of a balloon-tipped multi-lumen catheter, Swan-Ganz catheter, into the right side of the heart and the pulmonary artery to monitor pressure within the heart, intracardiac pressure, and pulmonary arterial pressure. Intracardiac pressure manifests the pumping ability of the heart. Indications. For patients with heart failure, cardiomyopathy, congenital heart disease, and valvular disease, it helps measure pressure, oxygen, and cardiac output of the right heart to assess the severity of dysfunction. It also helps measure pulmonary capillary wedge pressure, which can be used to diagnose the severity of left ventricular failure and mitral stenosis. Pulmonary capillary wedge pressure is an indirect measurement of the left atrial pressure. Elevated pulmonary capillary wedge pressure suggests left ventricular output failure. In suspected pulmonary hypertension, it helps measure mean pulmonary arterial pressure and central venous pressure. Procedure: venipuncture, groin femoral vein, on brachial vein, neck subclavian vein. In this case, we are approaching right heart or pulmonary artery, so we are accessing the veins. Advancement of the Swan-Ganz catheter into the right heart. The catheter is advanced together with venous blood into the right atrium, the right ventricle, and up to the vessels of the pulmonary artery, where the heart pressure is measured. Contraindications. Absolute contraindication. Patient refuses to undergo the procedure. Relative contraindications. Comorbidities in which the risks associated with the coronary angiography are greater than the benefits of securing the diagnosis. Relative contraindications are decompensated heart failure, acute renal failure, uncontrolled severe hypertension, bleeding disorder or anticoagulated state, allergy to radiographic agents. Periprocedural complications, complications at the site of vascular access, superficial hematoma formation, retroperitoneal hematoma, pseudoaneurysms, arterial injury can include laceration, atriovenous fistula formation, or thrombosis. Complications at the cardiac level. Myocardial infarction. Myocardial ischemia can occur due to vessel wall spasm or embolization of the debris. However, the risk of manifest infarction is less than 0.1%. Patients with a recent history of NSTEMI and diabetics on insulin therapy are at a higher risk of periprocedural MI. Arrhythmias can be induced by catheter introduction into the right or left ventricle. Most common are ventricular premature beats. Spontaneous coronary artery dissection in the artery affected by acute coronary occlusion. Injury to coronary vasculature by the catheter, for example dissection of coronary artery wall. Other complications: hypersensitivity to contrast media. Acute kidney injury can occur due to hemodynamic instability, radiocontrast toxicity, or atheroembolism. Cholesterol embolization syndrome. Delayed complications: restenosis, most common complication after balloon dilatation, up to 40% if there is balloon dilatation without placing a stent. Complication of restenosis is up to 40%, after bare metal stent placement less than 30%, after drug-eluting stent implantation only less than 10%. Stent thrombosis, stent occlusion via thrombus, higher risk after drug-eluting stent implantation, indication for longer dual platelet inhibition. If drug-eluting stent is placed, dual platelet inhibition therapy is required for a longer duration. Usually aspirin and clopidogrel are given to the patient for long term. Vascular complications, spontaneous coronary artery dissection, systemic embolisms. Infection localized or generalized bacteremia can also occur. Thank you.